There are all sorts of options in the world of cosmetic enhancement, and I know some of you out there don't want to do anything surgical. You don't want to do anything that is invasive or too serious. So pay attention to the next story. We're here with Dr. Muhn, dermatologist extraordinaire, and Bev, our patient today. And we're talking about minimally invasive procedures for facial rejuvenation to give you that little smile and shine and like softness, right, Dr. Muhn?
Yeah, I think that you hit it right on the head. A couple of things. Number one, when we're doing these procedures, we're just trying to soften an existing person, and we're not trying to recreate a new person. And I think that's important. Those days are gone by.
Mm-hmm.
And so for Bev, she shows one of the classic signs of aging, very predictable, where there's loss of substance beneath the cheek here in the center of the face. Gives a sign of fatigue, tiredness, makes the bags beneath the eyes more prominent, makes the folds here more prominent, and addressing that has a lot of wide-ranging benefits.
And what will you be using for the this portion here?
Yeah, so for the filling, we're going to be using hyaluronic acid.
Right.
The brand name we're using today is Perlane, and this hyaluronic acid is something that's already part of our face, already part of our skin.
And we lose it as we age, right?
Right.
That's the whole point, is that we deflate a little bit as we age, as we lose the hyaluronic acid. Basically, you're putting a little back in.
That's right.
To plump her up to like what she looked like maybe 5-10 years ago?
5-10 years ago, and again, putting something natural back in, and that's important.
Okay, and what about for downtime for her? How long will this, like when she leaves here today, Dr. Muhn, what will happen?
Well, she could have a little bit of swelling, small risk of bruising that could last several days, but she can go back to her normal life tomorrow morning.
Okay, good. All right, well, let's get started. Let's see how it all works.
Okay, here we go.
Okay, so I see you've got some ice there.
Topical freezing and ice. So we're going to be injecting the cheek, and it goes right down deep.
What's interesting is hyaluronic acid seems to be the injectable of choice in terms of filler, right?
It is. There's a lot of great reasons for using it. Number one, it's natural, whereas the collagen comes from somewhere else. Number two, if I really dislike this, or she disliked this results, I can actually put something in to make it all disappear.
Oh, that's,
which is a wonderful benefit.
That's good to know.
Yeah,
that's good to know.
Yeah.
Okay, so Bev's getting extra special treatment today, right, Dr. Muhn?
That's right.
She requested to remove that little mole right there?
Taking a mole off, there's many different ways to do it.
All right, how are you doing it?
Well, we're going to